In this trial, we use Palbociclib, which is a treatment that is already approved in the US for patients with hormone receptor positive breast cancer. So this treatment targets CDK4/6, which is something that is in relation to the cell cycle. So actually, despite that the treatment is been approved, as it happened with other targeted therapies, so we don't know we cannot predict the patients that they're gonna respond. And it has always been tested in combination with any other treatment. So it's very difficult to assess what it is, its effect on its own. So this is why in this trial, what we did is to give 3 patients out of 4 the Palbociclib treatment for just 14 days. And the other patients were just waiting with no treatment for the surgery. So, and then we analyzed the tumors from all of the patients treated and untreated, both at the beginning when they had the diagnosis of the tumor and then at the moment of surgery. And what we could see is that actually the effect on proliferation from this drug, it was very important, even maybe higher than anticipated. And this was even more, more important in tumors that were hormone receptor positive. To give you an idea, in the hormone receptor HER2 negative tumors, at the moment of the surgery, 70% they had levels of proliferation. They were nearly undetectable, so very, very low. So it clearly stopped the proliferation of the tumor with just only, as I said, 14 days of treatment, which normally the drug to consider a cycle, you have to give it for 1 month. Okay, so, and what we saw as well is that nothing that we looked at the baseline, so not a single characteristic of the tumor was able to predict where were the patients that they're gonna have this decrease in proliferation. But very interestingly, we're looking at the retinoblastoma, so phosphorylated retinoblastoma, which is something that has been involved in the cell cycle. It was able to tell us after 2 weeks of treatment which patients were not going to benefit from the drug.